5-minute jumpstart your dreams now.
Hello everybody, my name is Edwin, co-founder of Fleming MedLab. We design exoskeletons to help stroke survivors walk again and recover their brains. Now, quick question, do any of you know or heard of people who got stroke? I bet the answer is yes, right? Because the fact is that there are 15 million more new stroke cases every year. But what we do not know is that over half of them cannot walk afterwards, and that's where we want to start. Now, the reason why they cannot walk on the left-hand side is what we call the foot drop issue. It oftentimes trips the patients over and fall down, and that also leads to a subsequent stroke event. Currently in the market on the right side, the options are too heavy, too bulky, and they're not designed for stroke. So what that means is that when our patients use that for extended time, sometimes it worsens the conditions. Now, what we do, because stroke is a brain attack, we adopt a neuroscience principle called use it or lose it. We want to train it more. Step one, on the left side, the robot mechanically lifts the ankle, but it only moves when it detects there is a human intention, the brain signal sending out to the feet. So it will start moving. Then step two, we electrically stimulate the muscles in calf and also on the thigh to amplify the neural signals. Now, two together, we can stimulate certain brain cortex and change the brain texture. Technically speaking, that is what we call neuroplasticity change. Now, we have two sets of products. The left side, the hardware products, we have 3 US patents, and it's classified as a Class 2A medical devices. What you can see here is that when it's worn on the patient, it's very labor efficient, doesn't require a lot of people to hold their hands, and then we can collect data along the way on the right side as well. So what that means is that one set of robots, adding with the machine learning algorithm, we can fit on thousands of patients. Another key highlight is that after 4 to 6 weeks of trainings, usually patients can walk faster and also walk longer distances. And other thing is that our applications is not just for the doctors, therapists, but actually also for the family members as well, because they are very eager to know that when can their patients, recover well, start walking, and there's not something done in the industry before yet. Now, in the entire market, we are talking about over $258 billion US. What you see just now is step 1 and 2, the inpatient products, as well as the software. Now, what we do after 3 to 4 years of collecting data is that we can, at the step 3, design something for the home base to complete the entire rehab cycle. What we do is purely B2B, selling to hospitals, clinics, and rehab centers. Now, currently, we are in 2 major events. First, we're carrying out our pilot trial with around 10 to 15 subjects in the group right now. Second thing is that we're also speaking with overseas hospitals. I just went to London as well as Sydney to talk to their hospitals right there to carry out a potential phase 2 clinical trials there. Now, entire business model originally only start from the left side, selling the machines one by one. But then after collecting feedbacks from Hong Kong clinics, we are now also offering the rental models. Now, 2 together, we're foreseeing around $5 million US in 2 years' time. Our team comes from rehab science, physics, engineering, and medical sales background. So we do not just have to know how to build from 0 to 1, but we can also scale it as well. And this is the entire timeline. We started from last year, January. Now we have gone through 4 iterations and currently in the trials that we said. And then we also have gotten some other tractions in the market. So this is how we work. Imagine the patient is stepping on this ankle and then stepping on this sandal as well. So when they are walking on an actual movement, they will step on the heel, the ankle will lift up. And then when they do the toe off, what we call push off, and this part will step on another sensor, and then the entire mechanism of the robot will activate again. I think that's time for me. But then during the Q&A, I can answer in both Chinese and English. Thank you very much.
Okay, may we now invite questions from the judges? Thank you.
So I see there's a device with a screen, the box. It is attached to the
waist.
Okay, I see.
So it's a control box. So 我用中文講啦，因為佢係一個control box 嚟嘅。咁佢咧就會你如果頭先個相你會見到好似有條 pipe 咁樣嘅東西咧，嗰個唔係電線嚟嘅，嗰個係一個氣泵嚟嘅。因為我哋成個產品同其他最唔同咧，我哋唔係一個用金屬嗰啲傳統機械人啦，我哋用氣動式嘅設計，所以嗰條氣泵咧就會連喺個腰包嗰度啦。Another thing 咧就係佢都有一條好似data transfer 嘅傳輸管啦，咁我個 robot 收到嘅所有 data 咧，就會 connect 翻去我個 control box， 跟住個 control box 可以 store 大概2至3個鐘嘅 data， 跟住再 up 翻落去我哋個 main computer 去 up 上個 cloud 咁樣嘅。
嗰個 device 有幾重啊
？OK， 成件事就大概係700 gram， so 你可以當係一隻我呢啲咁重少少嘅 boot 咁樣嘅重量度嘅啫。咁如果
係用電去 charge 嘅。
係啦。
咁佢如果行一次可以行幾遠？
佢嗰個電咧，佢有嚿大電池喺個 control box 入邊啦。咁成件事叉完之後咧，就可以行3至4個鐘左右嘅。咁但係因為我哋每一次個治療師，譬如我哋會建一個1 hour 嘅 session 嘅 program， 但係 within 1 hour 咧，可能用我哋嘅 robot 就係20分鐘，其他40分鐘我哋會有其他 recommended schemes 俾佢做咁。
OK， 唔該。
可唔可以介紹多少少下一步個產品個 roadmap，即係有啲咩我哋可以 anticipate？
嗱，咁而家咧就 vertically 同埋 horizontally 啦。vertically 咧，咁啱啱你哋見到嘅全部都係一啲 inpatient， 我哋要入醫院入clinics 嘅。咁呢個係 inpatient stage 啦。咁但係當我哋去 outpatient 嘅時候咧，我哋就會再做一個再 lightweight 少少，因為你啱啱見到嗰個其實唔係 for 你24/7去戴嘅，真係一個好 rehab 嘅東西啦。但係去到 outpatient 咧，我哋除咗會有一個 lightweight 少少嘅 rehab devices， 同埋我哋都會有一個叫 daily assistive 嘅 device。你當好似個 patient 一瞓醒覺就可以着好似一對襪或者一個 bra top 咁樣，因為係一個好 supportive 嘅 ankle brace。咁呢個係 vertically 係專門做 stroke 呢一個 spectrum。但 at the same time 咧，啱啱嗰個 exoskeleton's development timeline 咧，其實我哋都有其他 joints， 譬如呢個叫 knee 啦，同埋我哋有啲手嘅東西啦。knee 嗰個咧就係我哋做完 ankle 就會緊接落嚟，而家準備 develop 㗎啦。咁嗰個位嘅expansion 就係會 horizontal 嘅，就唔係淨係做 stroke， 我哋會 expand 過去隔離做一啲叫做 frail elderly， 即係唔一定有病，但係可能衰弱咗少少嘅老人家啦。又就可能譬如我自己行山行得多，我都會用嗰個膝頭嗰個 brace 咧，可以幫我行山冇咁攰。咁嗰個就會係我哋叫做 general machine 嗰個 pathway。咁 so because of 我哋係做咗13485即係 medical device 先啦，咁我哋可以 gain 咗一個 credibility， 跟住再喺嗰度 spin off 出嚟做一個 general machine， 係會容易過我哋 first off 就做一啲普羅大眾嘅嘢。
Time is up. Thank you. Thank you so much.
Thank you.